Hi, I'm Dr. John. I'm a pediatric dentist here at PDAO, and today we're going to be discussing briefly fluoride exposure and when to introduce, what fluoride to your child at what age and what that looks like. First, we'll start talking about toothpaste. It's the most easily identifiable thing we need to talk about when it comes to fluoride, because usually there's fluoride in toothpaste or maybe there's not. And a lot of patients, parents will ask us, okay, do I use a fluoridated toothpaste or do I not use a fluoridated toothpaste? Like a training toothpaste is what it's labeled as in the stores. And so basically the AAPD, or American Academy of Pediatric Dentistry, they came out with guidelines that kind of give us an age ranges for how much toothpaste we should be putting on our kiddos' toothbrushes when we're brushing their teeth. And so we kind of break it down in three different categories. There's the 0 to age 3 years, and then there's 3 to 6, and there's 6 and beyond. And so we'll start with that birth to about 3 years of age part first. And really that just comes to whenever the first tooth erupts into the mouth is when you can start using toothpaste. And how much we're going to use from 0 to 3 is just a smear amount of toothpaste, or some might describe it as a rice grain size amount. So just a little bit, you just kind of smear that on, and then the main thing is you just want to get really good contact with the teeth to mechanically disrupt like bacterial plaque that causes cavities. But a little bit of fluoride can really help with remineralizing the teeth in the event that, your toddler had this little sugary snack earlier in the day, or something that is known to cause tooth decay or kind of demineralize the teeth. So that's a perfect way to introduce fluoride from ages 0 to 3. From 3 to 6, we recommend a pea-sized amount, or like a green pea-sized amount of toothpaste. Not much, not even enough to cover the head of the toothbrush, just a small amount. And then after that, they can spit the toothpaste out. That's around that time you're going to be teaching them how to spit. And so if they swallow a little bit, that's totally fine. Ultimately, it's that time to be teaching them how to spit, but it's still a small enough amount where it's not going to do any harm. Twice daily, pea-sized amount of fluoridated toothpaste. And then 6 beyond, by that time, most kids have developed their ability to expectorate or spit out toothpaste and other things pretty well. And so at that point, you can use a full ribbon-sized amount of fluoridated toothpaste on the toothbrush, and they can brush with that. And then here's the interesting fact: they can spit it out after they brush with it. And you may have heard this little part on social media before, kind of recently, like maybe on TikTok, for example. But after they spit the toothpaste out, assuming that they got most of that out of there, you don't have to rinse afterwards. You can rinse with a fluoridated mouth rinse, or they can just spit it out and they don't have to rinse with water. Because when they rinse with water, what happens is the fluoride that's remaining on the teeth, which is good for remineralizing the teeth and avoiding cavities, a lot of it gets washed away. So avoid rinsing with water after brushing the teeth, if at all possible, for at least 30 minutes. If you have any questions about the use of fluoridated toothpaste or fluoride in general, feel free to leave a comment below and we can get back with you.